Gluteal region. So it included the posterior aspect of the hip bone. So here we can see the hip bone, gluteal surface of the hip bone, posteriorly, posterior superior iliac spine, posterior inferior iliac spine, greater sciatic notch, ischial spine, lesser sciatic notch, ischial tuberosity, acetabulum, cup-shaped depression is a acetabulum. So on the gluteal surface, posterior to anterior aspect, origin of the gluteus maximus muscle, fan-shaped gluteus medius muscle, and also a fan-shaped origin of the gluteus minimus muscle. And here there is origin of the tensor fascia lata. So posterior to anterior aspect, gluteus maximus muscle, gluteus medius muscle, and gluteus minimus muscle. Here the reflected part of gluteus maximus, reflected part of gluteus medius, and here there is a gluteus minimus muscle. And from the inner side of the obturator foramen arises the obturator internus muscle, and from the lesser sciatic notch, upper and lower margin, arises the superior gemelli and inferior gemelli muscle. Origin of the gluteus maximus from the gluteal surface of the ilium, from the gluteal surface of the ilium, outer margin of the iliac crest, from the dorsal segment of the iliac crest, dorsal surface of the sacrum, and sacrotuberous ligament. Incision of the gluteus maximus, it inserted into gluteal tuberosity. And gluteus medius, incision over the lateral side of the lesser trochanter. Its incision is directed forward and laterally. And gluteus minimus, inserted over the anterior surface of the greater trochanter. So from here on the gluteal tuberosity, insertion of the gluteus maximus over the lesser aspect of the lesser trochanter, gluteus medius, and anterior aspect of the greater trochanter, that is gluteus minimus. On the gluteal tuberosity, gluteus maximus insertion, lateral aspect of the greater trochanter, gluteus medius, and anterior surface of the greater trochanter, gluteus minimus. In gluteus maximus, 3/4 it inserted into the iliotibial tract and 1/4 inserted into the gluteal tuberosity. So let's see the muscle of the gluteal region. On the gluteal surface, below the gluteus medius, gluteus minimus, above it is a tensor fascia lata, gluteus medius. So these muscles are below the gluteus maximus muscle. Gluteus minimus, gluteus medius, piriformis that arises from the anterior surface of the sacrum that passes through the greater sciatic notch. So this muscle, it is a piriformis. Then this is the obturator internus with two gemelli. Then this is the quadrator femoris muscle. This is the quadrator femoris muscle. and below the quadratus femoris, adductor magnus muscle. Ischial part or hamstring part of the adductor magnus muscle. This is the adductor magnus muscle. And from the ischial tuberosity, from the gluteal tuberosity arises the hamstring muscle. Obturator internus arises from the inner aspect of the obturator foramen that passes through the sciatic notch, this tendon, along with the superior gemelli and inferior gemelli, and it inserted into the medial aspect of the grater trochanter. Quadratus femoris arising from the ischial tuberosity and inserted over the quadrate tubercle in the upper part of the femur, posterior aspect of the femur. Nerves of the gluteal region that arises from the lumbosacral plexus. So lumbar plexus is formed by the L1, L2, L3, L4 roots. Here there is a psoas major muscle. When we reflect the psoas major muscle on the posterior abdominal wall, there is a lumbar plexus, and from the L4, L5, S1, S2, S3 and S4 root form the sacral plexus. So here there is a three abdominal muscles that fold upon itself, and from the anterior superior iliac spine to pubic tubercle it forms the inguinal ligament. So lumbar plexus passes into thigh below the inguinal ligament. In the sacral plexus, the nerve passes through the gluteal region through the greater sciatic notch. Here there is a greater sciatic notch. So through the greater sciatic notch, the vessels and nerves enters into the gluteal region. So this piriformis is the key muscle of the gluteal region, the vessels from the greater sciatic notch that enters into the piriformis, enters into the gluteal region above the piriformis and below the piriformis. So here we can see this is the superior gluteal nerve and superior gluteal vessel. So this dotted line that shows a nerve between the gluteus medius and gluteus minimus. Structure passes below the piriformis. It is a sciatic nerve. One is the sciatic nerve, posterior cutaneous nerve of thigh, inferior gluteal nerve and inferior gluteal vessels. And the three structures that enters from the greater sciatic notch to the lesser sciatic notch and that lies above the ischial spine, that are the nerve to the obturator internus muscle, internal pudendal vessels and pudendal nerve. So there is a pin structure PIN. P for pudendal nerve, I for internal pudendal vessels and N for nerve to obturator internus and nerve to quadratus femoris. That also supplies the inferior gemelli, and nerve to obturator internus also supplies the superior gemelli. So nerves arising from the spinal cord, there is a two roots, dorsal root and ventral root. So ventral root is motor and dorsal root is sensory. And these two root unite and it divides into and it forms the nerve. So this nerve, spinal nerve, then divides ventral ramus and dorsal ramus. So this ventral ramus, it is also known as the anterior ramus. Ventral ramus is also known as the anterior ramus and dorsal ramus also known as the posterior ramus. So brachial plexus, lumbar plexus, shoulder plexus is formed by the ventral ramus. So here we can see this nerve arises the nerve and the plexus is formed by the ventral ramus and this ramus is divided into divisions, ventral division and dorsal division. So the sacral plexus enters into the gluteal region passing below the piriformis through the greater sciatic nerve. And lumbar plexus enters through the anterior part below the inguinal ligament. So here we can see the sacral plexus enters into the posterior region or gluteal region. So we have seen the nerve. It is the superior gluteal nerve, inferior gluteal nerve. So superior gluteal nerve supplies the gluteus medius, gluteus minimus and tensor fascial lata. These three muscles. So action of these three muscles, it is a medial rotator of the hip joint. Gluteus medius and gluteus minimus and tensor fascial lata. It is the medial rotator of the hip joint and abduction of the hip joint. Then this is the inferior gluteal nerve that supplies the gluteus maximus muscle. Action of the gluteus maximus, abduction, and it is the chief extensor of the hip joint. Action, it is an anti-gravity muscle. So we standing from sitting position, it is action of the gluteus maximus. And extreme action like running and walking upstairs, the it is action of the gluteus maximus. And while we are normally walking, that action by the hamstring muscles. Now to obturator interna, now to quadratus femoris, sciatic nerve, pudendal nerve. So these are the nerves of the gluteal region. So let's see the root value of the three nerves arising from the dorsal division, that are the superior gluteal nerve, inferior gluteal nerve and nerve 2 piriformis. So superior gluteal nerve, so sacral plexus, it is formed by the L4, L5, S1, S2, S3 and S4. Superior gluteal nerve root value L4, L5 and S1. Inferior gluteal nerve root value L5, S1 and S2. And nerve 2 piriformis S1 and S2, dorsal division. And nerve 2 quadratus femoris root value ventral division of the L4, L5 and S1. Now to obturator interna, it is L5, S1 and S2. And pudendal nerve root value is S2, S3 and S4, ventral division. Sciatic nerve root value ventral division L4, L5, S1, S2, S3. That is a tibial component of the sciatic nerve. And dorsal division, that is a peroneal component of the sciatic nerve. That is L4, L5, S1 and S2. In the posterior cutaneous nerve of thigh or posterior femoral cutaneous nerve. Root value dorsal division S1 and S2 and ventral division S2 and S3.